So once you've decided to become a nurse, there are some things that you gotta, learn or teach yourself or take classes in to become the nurse. Now, there's the prereqs that you have to take. That's something that you have to take in order to complete your program at your school. And outside of the prereqs, there's not really any other classes that I would advise that you take. I know in some programs they'll say, take this English. It'll help with this class further down the road. In nursing school, there's not really a course that'll help you. Of course, I always advise take the CNA first. Become a CNA first. Work as a CNA first. Working as a CNA will help you learn time management skills, and you'll get advice from other nurses because you will inevitably be working with nurses. You'll be working with people who's been there, done that. They'll help you. The nurses that I worked with helped me while I was in nursing school, and I was also working as a CNA. They would tell me, you probably don't need to know this, or you definitely need to know this, or, so on and so forth. So, number one, become a CNA. Take the CNA course. And take the CNA course at, if you can, where you're going to nursing school at. Or take the CNA course at a place that has nursing school. I took mine at the community college that I went to, and it had the nursing program with it. It was kind of a joint venture. So I would advise, if you have the ability, to take the CNA course where you do your nursing program. That will help you. It definitely helped me. Not only do you know the professors or the instructors, because you've been taught by them already, but you know how they test, so on and so forth. You know the campus, stuff like that. Another thing I'd advise, I don't even know if this exists anymore. It existed when I took the nursing program. It's called the TEAS test. There are books out there that teach you how to do the TEAS test. TEAS. TEAS. It may be called the TEAS-V. Sometimes there's a HESI. I didn't take HESI, I took TEAS, but HESI and TEAS are kind of the same thing. These are not nursing-oriented tests. They're not. They're like how you look up numbers in a phone book, or how are clouds made, or things like that. But what they teach you, if you learn from the books that I rented one from the library. What you learn, if you actually read the book, is how to take a test. And in nursing school specifically, it's the only place I know of that does this. It's not the right answer, but the most right answer that is the right answer. So let me give you an example. The question will read something like, you come into the room of a patient that's had a head injury. What do you do? Ask them their name or birthday, get vitals, do the 3 med checks, or do an assessment. Know the answer? Name and birthday. You don't want to know why? Number one, you got to identify the patient, but most importantly, that patient's had a head injury. You got to know the cognitive ability of that patient. If they can tell you your name and birthday, maybe ask them some more questions to see what they know. So that's a question that I would have gotten wrong, because initially I would have said get vitals, because you don't know what's going on with that patient. But the key words in there were head injury. And the TEAS and the HESI, the books that you read that go with the TEAS and HESIs, will teach you. Look for key words. Look for key phrases. Read every answer. Don't answer the first time, don't answer your first response or whatever. Those things will help you. Kaplan, I've got a video on Kaplan. They also have books out there that will help you. And Kaplan, they will also teach you how to take a test, how to take a nursing school test. Nursing school tests are beast. They're horrible. I don't like them. So those are my 3 test taking or books that you should read. You don't have to read all 3. I would advise that you read at least one of them. I read the TEAS-V. It may or may not exist anymore. I had to rent it from the library. And I was advised to do that from a nurse that I went to school with. Or not a nurse I went to school with, a nurse that I worked with at the hospital. She told me, read this book. You'll actually get something out of it. And the questions in that book, like I said, are, how do you read a phone book? How are clouds made? How is DNA synthesized? Things that you don't use in nursing, but will help you look for the right answers in the test, the most right answers in a test. So, become a CNA, read those books. Number 3, time management. When you're in nursing school, time management is everything. In nursing, time management is a lot. But learn time management skills. I don't know if there's a class on that, or if you can just kind of, measure out your day by hour and make a schedule that way and try to stick to it. I really don't know how to kind of teach you how to do time management. I had a really hard time with it. I truly did. It was hard for me to get. But that's really it. There's no really class or course that you can take that will prepare you. Just, that CNA and getting that experience, getting your foot in the door with the experience of that CNA, that is the biggest. That's the biggest thing. That's the best one, because you will get advice from nurses firsthand immediately, and you'll be able to say, hey, thank you, nurse, for giving me this advice. Thank you for helping me on this test, and so on and so forth. But I hope it helps. Thank you much.